want to thank you for being a part of this exclusive Ask To event. To our panelists, our experts, and all of those who have dialed in tonight, we do thank you for taking time to address such an important topic. Of course, during COVID-19, the holidays are approaching. There's a lot to talk about. So we'll get started here. We'll allow you to have some brief opening remarks. And we have some ground rules to go over, Haley.
Yeah, so we just want to remind everyone this is a sensitive topic, and we are being cognizant of that, and the respect and privacy of all of our participants. So you guys are all going to remain muted, and you're going to have your monitors off throughout the conversation. Of course, you can also turn those on if you wish. If you are comfortable posting your question publicly, you can submit the questions in the chat section. You can also send a private message. To send a private message, you want to send it to the KPRC profile that you see in the chat room right now. And then we would be able to ask your question anonymously. And we do have quite a few questions already submitted, so we look forward to getting started.
Obviously, we want to keep this cordial. We want to make sure that everyone is respectful of other people's questions, concerns, or thoughts. And first, we'll address some questions that were submitted via registration, and then we'll answer questions that, again, some of you may have. So the participants, again, just submit everything through the chat room. So Haley, why don't you kick us off?
Yeah, we're going to start by introducing our panelists now. Joining us today, first, I'll mention Dr. Andrea Taylor, psychologist with UT Physicians and UT Health. And Dr. Taylor, would you like to say something about your specialty?
Absolutely. First of all, thanks for having me and the other panelists here this evening and addressing very, very important issues. So again, I'm Dr. Andrea Taylor with UT Health, UT Physicians. And I currently work at our Trauma and Resiliency Center. Prior to that, I worked at one of our UT Physicians outpatient clinics, as well as the Harris County Psychiatric Center and LBJ Hospital. And so I've had the opportunity to work within the Houston area probably since 2007 in different capacities, primarily with adults dealing with a lot of anxiety and depression. And that's part of what we know we'll probably be addressing tonight, and especially over the course of the holidays. This tends to come up, and to complicate that, we're dealing with the pandemic. So thank you so much for having me this evening as a part of this panel.
We are, again, grateful of your time. So thank you again for being here. Dr. Diba Ushroff, psychiatrist with Menninger Clinic.
Yes, that is me. Thank you. At the Menninger Clinic, I work at the young adult unit, and we specialize in depression, anxiety, personality disorders, eating disorders, substance use. I'm also an advanced candidate at the Center for Psychoanalytic Studies. So what I'm really interested in is understanding fully kind of the underlying patterns behind these symptoms and really getting a full understanding of the individual. So that's the work I do. So I work with young adults, but also all ages.
Okay. And Dr. Daryl Knox, Chief Medical Officer at the Harris Center for Mental Health. Dr. Knox, would you introduce yourself?
Yes, well, thank you, Haley. And I too, I'm glad to be here. I'm Dr. Daryl Knox. I'm a physician, psychiatrist, and I am the Chief Medical Officer at the Harris Center for Mental Health and IDD. We are a large community mental health center. We diagnose, assess, and treat people who are experiencing mental health problems. We see adults and children, and our services are provided to the community without ability to pay. So if you don't have insurance or don't have money, we can certainly still serve you.
Thank you, Dr. Knox. And now Director of Education and Programs, Angelina Hudson with NAMI Greater Houston, which is National Alliance on Mental Illness.
Yes. Hi, Kris. Thank you, too, for including us in tonight's discussion about mental health. So I work for NAMI Greater Houston. I'm program director here, but our services are for the family members, the caregivers, the loved ones of those who might be diagnosed or struggling with signs and symptoms and not yet diagnosed with any mental health problems. We also serve the person who is identified as the person who's who's diagnosed, so we have classes and support groups for family members, and we have classes and support groups for those who might be struggling for their own recovery and want extra support. We also run advocacy initiatives and a warm line to kind of help families navigate what to do first and next and next and next.
All right, panelists, thank you so much for introducing yourselves. As I mentioned, we have already gotten some really great questions submitted, so I want to get right to it. One of the first viewer questions that we received today was that we are getting a lot of mental health advice during COVID. One of the main things that we hear a lot is that it's okay to not be okay right now, right? And this person says that they've gotten the advice to get through, even if you get through half of your normal to-do list, that's okay to, lower your expectations. But this person says that has impacts on your job. It has impacts on your family life. So how does letting yourself off the hook like that square with your commitments? Anyone have advice?
The last part of that, Haley, how does it square with your what? With your
commitments, with your job and family commitments.
Yeah, I know here we have employees, and our job is to be there for people who are mentally ill, but we realize that our employees have stressors as well. Many of our staff are working from home, they have small children and that sort of thing. So we're hoping that your employers are showing you some grace, and recognizing that you need to cut some leniency during this time. So I think a lot of businesses are certainly doing that. And if not, you should probably have a talk, with your HR department or your supervisor, about your stress and what's going on, and see what kind of accommodations, they can make for you.
I think that's a great point, and I'll just kind of further that conversation. Again, it's open to any of our panelists. Kids at home may not understand that, especially given different ages of children. So how do you kind of keep everything composed, and what should we be doing if we need an outlet?
Well, I think, Kris, we don't need to keep everything composed. And I think that's part of what we're saying is it's not abandoning all expectations, it's adjusting our expectations and saying that especially given the circumstances, especially given the pandemic, and the impact that it has both on a just very practical level, but also on an emotional level, it's okay to adjust those expectations. And as Dr. Knox was saying, it is also okay to ask for help, to reach out to your employers, to ask friends and others for assistance, and also just not to expect the same of ourselves. That said, I think we need to selectively prioritize certain things. So absolutely, if it's going to be affecting your work, there are certain things within your work that you have to prioritize, and then other things may kind of fall lower on what would be our traditional totem pole. And that's where we have to give ourselves some grace, again, to borrow a term that Dr. Knox used. When it comes to our children, children are often pretty understanding. And I think if we have age-appropriate conversations and let them know, it also teaches them about how to deal with emotions, and that things are it's okay if not everything is okay. And sometimes, things are going to be a little bit more messy, but maybe you can help out with this, or maybe you can help out with that. Or, sometimes I'm just feeling a little bit sad. And do you ever have times that you feel sad? So I think in a way, kids are more resilient. And if we try to hide everything and pretend that everything is okay, one, they pick up on that, and that's actually not modeling healthy emotional learning for them.
Well, to touch on the children topic a little bit more, the kids who, I don't know if this viewer has older teenagers or what, but they do mention that phrase that we've all heard, everything's fine, I'm fine. So what are some of the signs that your children is depressed or anxious when they're telling you that they're fine?
I would think any changes they might have in their usual behavior, if they become more withdrawn, if they were doing well and are not doing well, in school. Certainly if they talk about being depressed, or they, look sad, crying, not eating, not sleeping, those might be some early signs, or that there may be some emotional distress going on. You're right, with teenagers, it's hard to pull it out of them. So you have to be observant and leave the door open for communication.
You know, I want to add in a perspective from a family member. We call this Corona world, and it's just a new normal for many of us. Like you were mentioning, Dr. Taylor, the adults and the children. So it's time to kind of change our coping skills. Look for something outside of the box that you have not used in your toolkit before to manage the level of stress that you've not had to face before. And there's writing clubs. There's so many things now that are online. I've been, scouring internet and Facebook. And one of the things I noticed is that there's a lot of warm lines out there. So if you contact a warm line, I know NAMI Grady Houston has a warm line, and it's specifically designed for parents to navigate, some new coping skills, new strategies, new ways to manage what's going on, not necessarily for a mental health condition, but for the signs and symptoms of overloading stress in our lives. What do we do if we've never had a diagnosis before? And so I think that, reaching out to some of these warm lines, we have a wonderful one-pager that I can, share with you and post, and just reach out to someone. When you recognize that it's more than you can handle, this is the time to pull those lifelines in and find different free things you can do to support yourself and your family.
Wait, I'm sorry if this is common knowledge, but what's a worm line?
Oh, so a hotline is sort of a crisis line. You think of 911, there's some critical situation going on. A warm line is, it's not a crisis. I don't need the fire department, the police. I don't need a crisis team, but I need help. I'm struggling. And so there are many warm lines that have been created. I know the Harris Center has a COVID line. NAMI, like I mentioned, Grady Houston has a warm line. The city of Houston, actually through their health department, has a warm line. And these warm lines are there for families to sort of build up their resiliency power packs to figure out, how to navigate the world that we live in now and keep everybody in a homeostasis, how to keep everybody calm until we get past this pandemic.
Could a warm line be someone that you know? I mean, could a warm line be a best friend who you have relied on in the past to just call and just talk things over with?
So that's to me, and you can correct me, the doctors on the line, that's a strategy, that's a coping skill. Okay. Warm lines, though, are usually information and referral centers that have common issues that they can address and talk and listen and support people in finding the right kind of connections. But absolutely, I do believe having a nice set of friends that you can healthily dispose some of this angst and anxiety that we have. Right. Yes, that is definitely a strategy.
Dr. Ushroff, I want to turn to you because we are in the midst of a global pandemic. We do have the holidays quickly approaching. We have, as a nation, gone through this political turmoil of who voted for whom and who won the election, and we're happy and we're sad and whatever it is you believe politically. And then you also have the social unrest that we've seen in our communities. Are you seeing this when people come visit you? Are you hearing these things? And what are you telling people?
Kris, we're absolutely hearing these things. People are, what we've just been talking about is that we're out of our normal routines.
Right.
And our normal ways to support ourselves during a lot of difficulty. So we don't have the same maybe path of, especially kids and college students through academics, or the same trajectory maybe at work, the same level of connection with people. And so we're really stretched with how to cope. One thing I have seen is that at times people can use this chance to really explore some of the things that mean a lot to them. And so I think finding meaning and finding a sense of what your beliefs are and, kind of making more of an understanding of yourself and your identity in this time can really be helpful, so that people can actually, from their own homes, do things to connect with others that share their beliefs and try actually to help others in this time. So that's one way where you can feel a little bit, have a chance to help modulate your mood if you're actually doing things that you really believe in. So I think in some ways it actually lets people know that it's a signal to what's important to them when they bring up their concerns.
And another thing, Kris, is very important is for people to take a break. We love our news media, but sometimes you might need to take a break to look at something, to change your mind, to get your mind off of the stressors that are going on in the world. This has been an unprecedented year. 2020 has been, deemed the year that keeps on giving. We have a couple of more months left. So
you don't have to tell us. We have to go turn it off ourselves.
Yeah.
Yes.
That's true.
So, Dr. Knox, you had mentioned some, I'm sorry, did I cut?
Oh, no, I just think one of the ways another way to manage that is actually, kind of introducing, I think you guys were mentioning it, like just new things, into your routine that you wouldn't normally do. And so it takes some effort really to try to come up with a new routine that gives you those breaks. So that it's not the same as it was.
Right. And I think it creates an opportunity, just jumping off of what you were saying, to think outside of the box. And we like our routines. And at the same time, with this, what I've been calling the new abnormal that we're living in, we may need to think outside of the box. Yeah. But I think it's also an opportunity, again, with all of the tension that's been going on, the division, et cetera. I too have heard all of those things brought up by my patients, to really kind of sit and say, again, what's important to me? What is important to me in the people that I choose to interact with? What are the commonalities? What are the activities that bring me joy or that bring meaning? And it's also an opportunity, and I've seen this quite a bit, for people to reach out to people who maybe they haven't talked to in quite a while. And I know at the beginning of the pandemic, when people were feeling more isolated, and we were at home a little bit more, I saw people deliberately making contact with other people. And it's something that I encourage people to continue to do. I know as we can't gather together in person in the same way, sometimes even having, small little chat groups. My sister does a chat group with some of her college buddies. I may do one tomorrow evening with some friends from church that I don't get to see in person. So I think that there are ways that we really can continue to connect, to do something new, so that we're finding some of that support that we need, that we're not getting in the traditional ways.
And we may have to schedule it more than we used to, right?
Yeah.
That's what's different. It takes a little bit more effort than it maybe in the past.
Right. Hey, this conversation has sparked a question from someone who is watching and listening right now. And the question is specifically for Dr. Ushroff. As a father with a teenager, this person asks, how do we deal with the issue of fear of being forced back into in-person schooling?
That's a really good question, Dustin. I think it is something each family really has to, a decision that you have to make, managing the academic needs and the social and developmental needs of kids that are really just so very different from our own, that in a lot of ways, we struggle with, Zoom interactions, but there are some really pivotal moments that kids experience at school. And so you have to kind of look at risk benefits. And is there a way for you, if it feels unsafe, you have to kind of listen to that. If it feels unsafe, how can you manage those needs for your teenager at home, which is a struggle. So I think it's a tough situation, but it is one where you have to kind of balance that, what's actually happening with that your teenager at this time. How are they managing right now? Are they managing really well with Zoom school? Is that not really working for them? Are they really struggling? How can you work with your school maybe to find ways that feel safer? So it is a continuous sort of process. And hopefully you can get some help with it, help from school and possibly even from other parents. Like, how are other people experiencing that?
I'd like to dive a little bit deeper into the teenagers learning at home issue, because one viewer asked, during COVID, my son has become more addicted to gaming. And when I thought he was taking his classes, he was playing. Now he becomes violent if I take it away. Besides, he's found bypasses to my approvals, so parent controls don't work. I tried to work out structure times, but he's still hiding electronics and playing them at night. I know that a lot of parents will be able to relate to that. What can we tell them?
Well, again, that's a very individualized question, because if someone is more angry, it could be the signs that they're, experiencing stress. They're acting out. I think that families need to be creative and use times to do family things together. There are a number of people who made the best of the situation by scheduling times, with their kids. Also, you sometimes have to, lay down the rules. Okay, we're going to play games, for this amount of time, but then we're going to go and do something else and, get feedback, from that person about what needs to happen. But I do think that these are the kinds of issues when they become more, pronounced and more divisive in the family, that might be some time to consider, do we need some extra help? Do we need to go to a counselor or family therapist to help us work through this?
Kris and Haley, I just noted a question in the chat that talked about, what do I do if my child is saying, I don't want to be here anymore? And one of the things I recognize is that children kind of use their behavior instead of their words when expressing that they've really met their limit of what they can manage. And so if you see behaviors that are really beyond your control, if you see something that is really concerning or alarming, like eating patterns have really changed, they're sneaking out of the house, and especially if they verbalize, I don't want to be here anymore, then it's really time to pull in some professional help. One of the things that I know that parents do, parents say, these are my kids, they're my responsibility. I'm a bad parent if I can't manage this. I was supposed to know how to. No, it is not. There's nothing wrong with reaching out for help, especially at a time like this. So again, if a child is not sleeping the way they regularly do, if their eating patterns have changed, if their behaviors are beyond what you can manage anymore, and certainly if they get to the place where they can verbalize, not wanting to be here, it is sincerely time, like tomorrow, seek professional support. And you can start with your primary care provider and get a referral. And if you don't have insurance, the Harris Center, you could call the 713-970-7000 number and schedule an appointment.
So I'm wondering, how much does that cost? Because another viewer question was, are there resources for, this person asked specifically for online counseling that's inexpensive?
Yeah, I think the hotlines and the warm lines are all pretty much free. I mean, we have the 713-970-7000 number that's available anywhere to anybody at any time, managed 24/7 by professional staff, and they can talk to you, listen to you, make their appropriate referrals, tell you where to go to get help, and it's all free of charge. There are a number of agencies too that may have a sliding scale. If you can't afford the full fee, they may be able to, depending on your situation, reduce the fee. At the Harris Center, we do get funding from the state and some federal government to see people who have no insurance benefits or very, very financially limited.
Yeah,
and I think it's also important to reach out. So I'm primarily, even with ED physicians, I'm primarily practicing teletherapy. So, and most of my psychologist friends right now are also seeing our clients through teletherapy. That's both for adults, children, couples, family. So a lot of times people are a little hesitant because they're like, oh, well, I don't want to have to go into an office. But teletherapy is very much available right now. It's something, if you have insurance, check with your insurance companies to see if that is something that they will cover. Many will, particularly at this time. And so I don't want people to not access care because they're afraid of going into an office. I also don't want people to not access care due to the stigma. And there is a lot of stigma that goes along with trying to address any mental health type of issue. When we deal with our mental or emotional health, we are just dealing with our health in general, period. And even when I'm dealing with depression or anxiety or post-traumatic stress disorder, I just describe it as dealing with another aspect of your health that we need to take care of. And so the same way somebody, if they were having a lot of stomach pain, you know, if you went to see your primary care doctor, you went to see a gastroenterologist about it, that would be an appropriate thing to do. Those of us in mental health care, we are resources, and this is what we're here to do. And so I think it's a very wise thing to use mental health care resources.
And I think the hotlines and the warm lines are really anonymous ways. A lot of times people have fear of going in to see someone. So that's an anonymous. You don't have to give your name. We certainly would like it, but you don't have to give your name. You can just talk about your problem and solutions. So that's an entree. If you go to a church or a synagogue, a lot of times the rabbi, the pastor is someone you can talk to, and they may know someone in your congregation who can help you that you might know and feel less threatened and seeing. So there are a lot of avenues for that. And of course, your primary care physician. You know, we all have a doctor that we go to. That's a person too who really knows mental health professionals and probably has a resource of professionals that they can refer you to.
And one thing about, just to speak to like the lines of care, you know, this idea that sometimes people fear that once they ask for mental health care, they're going to end up in a hospital. Or and even with, you know, there are times, yes, you know, if there's concern about safety, you could be in the hospital for a short period of time, but a lot of the time, suicidal thoughts are managed on an outpatient basis because they don't just disappear. There's something you kind of work on, and you build, you know, different skills. You build understanding about these thoughts, and so that idea, I think that may be part of the stigma. Like if I ask for help, or if I don't want my child to end up in a hospital, I think those are fears, and I understand that, and I hope that you can hear that there's even with the young adults that I work with at the Menninger Clinic, they work in outpatient basis. There's groups. There's kind of what we call community reintegration, where they live in an apartment, but they like keep moving towards work and finding meaning. And then of course there's inpatient, but I think just recognizing that can be helpful for people. It doesn't mean that you end up in a hospital forever. You know, there's certainly so many more options.
Go ahead.
I was going to say there was one question kind of about that, about a family member who was worried about, or someone who was worried about one of their family members. They could identify that the person was depressed and struggling. They just didn't know how to start with that situation. They didn't know how to advise that person to where to start with getting help. I wouldn't even know what to tell them. What can we tell them?
That's the area where I think we're sort of, NAMI really provides the oil that's in between the gears of, let me keep doing what I've been doing and let me think about doing something new. What's in between that? And I can honestly say that, yes, if you call the warm line here, it's anonymous. You don't have to give any of your personal information. And the people who work in the warm line are people who've been there, done that, got the t-shirt. They're in recovery. They have their own story. And so they've been trained to sort of ask the questions and hold the conversation at the pace that person is comfortable with, to sort of figure out, okay, what's best, not just best in regard to your situation, but what's best for you. So it's very personalized, and you can hang up and call back. And so, so we walk that journey with that person. And the same with parents. If you're just trying to figure out where to go next, what to do first, then sometimes just the permission or the little nudge to engage and to trust the clinical or the school or the work community. Someone was talking about less productivity at home because of the stress related to the pandemic right now. Transparency is key. Being open and honest with your employers. And I feel like I'm talking to myself, and being open and honest with the school personnel about people are very fearful. If I call the Harris Center for help, I'm going to lose my apartment. We've had calls like that. And, we had to walk them through that. If I tell the school that I'm struggling at home, they're going to take my children away. No, they're not. You might want, no one's going to take. So we walk families and individuals through these very, very difficult fears and anxieties just around getting help.
Yeah,
I'm so glad that you're mentioning that, because I think a big part of what we do and what we're having the opportunity to do now is just to provide that education and information. Even what Dr. Ushroff was saying about if someone is having even thoughts of, I don't want to be here, worrying, well, if I mention that, am I going to get locked up in a hospital forever, in a straitjacket, never see the light of day, which that's not what happens. So I think we need a lot of education and information. People are worried, if I get help, will my employer know? Does my spouse even have to know? Not necessarily. Like your employer won't know. We as professionals don't tell your employer. If you come in and you are doing this on your own, you don't have family support, which is very helpful, and you don't want others to know. If we don't have a release of information, unless it is a life or death emergency, there are always situations where we have to break confidentiality. But I think a lot of people are just afraid of that to begin with, and that keeps them from just even trying to crack that door open. So I'm so glad that there are organizations like NAMI that can really help people walk through that process, and even just this information that we're giving today.
That's so true. There is no record. Like, there's no place that we write down what you say and then the whole world could read it. I mean, I know that sounds obvious, but there really is so much stigma, and there is a fear like, oh, my employer will hear this, my school will hear what I'm saying today, or it'll be when I apply for a loan, it's going to be there, and it's your medical record, it's confidential. So I think that's such a good point that you bring up, Dr. Taylor. It's a fear that comes up, and I think it is, and there's a lot of fear about just talking about mental health. It's scary, I think, and especially if someone's distressed, we're not sure how to reach them. I think one thing to try not to do maybe is to cheer them up, like but you're so great, and you're so smart, and and that may not kind of backfire. You want to hear what that they're in pain, and you want to get them to that next step. So just letting them know that you see that they're in pain. You may not understand it fully yet, because it may be hard to talk about. You can see it, and it's vulnerable. And these, just like we're talking about, you want to help your loved one. It may be just that hard for them to tell you what's inside, because they're so vulnerable. They think you're going to write it all over the sky and everyone will know. And it really is. It's a very delicate place. So I feel for you, but also knowing that you're just there to listen and help. And I think that's really valuable. And getting them to, however way you can with NAMI, that's awesome. To get them to the next step, where they can have speak to a mental health professional and figure out what's a good treatment plan. What are the options for that particular person? And as Dr. Knox was mentioning, the idea that it is very individualized. So some of these questions we're answering may be more in a broad way, like just get the help.
Sure. We did have a question about single adults that we saw come in, and there's another one here that I think kind of plays into that. So I want to kind of broaden this out again. This is for any of our experts tonight. This viewer says Zoom only goes so far. So what's your advice for singles who may be experiencing feelings of isolation and physical distancing from friends and loved ones? With the shortening of the daylight hours, sometimes come feelings of depression. What practices could we use to kind of stave this off in light of the force to be outdoors even more during the winter months to come?
What thought I have for single adults, I think that if you can find a group of people, maybe just two people or one person that you feel safe and you trust their ability to social distance, to be able to social distance with that person, still keeping safe, being outdoors, but maybe seeing them more regularly. Because agreed, I think it's very difficult to have, contact with people over Zoom. I think one of the benefits I had personally is that at Menninger Clinic, we go in, we see people in person, and we see our colleagues in person. and we keep it, we maintain safety. And I think I didn't realize that probably kept me more sane than I realized, because a lot of my colleagues have been working from home continuously, and that it's a lot of work. And there's the different kind of draining that you feel at the end of the day. So I think finding a safe way is kind of one of the things that I've seen be really helpful for people, so that you do maintain that connection. And of course, in a larger sense, finding activities that are safe. Drive-in movies. I went to one. It was great. Finding things that are fun and safe. But I think having that maintained contact, and of course the chats we were all talking about, chats, video messages, just bugging people, staying in touch. We want to bug each other a lot right now, so that we can stay connected.
Is that your same advice for someone who says they are bipolar and their symptoms are getting worse, they feel, because they're doing Zooms for their meetings instead of going to the face-to-face meetings? They say that they didn't feel comfortable because people weren't wearing masks. So I have to praise that person for doing what they felt more comfortable with, but they're saying that lockdown has been challenging and making their symptoms worse. Is that kind of the same advice that you were just giving?
I think it's even more so. If you have a pre-existing condition, the stressors are even more impactful on your life. And so we see a lot of patients that we have been seeing, via video conference. We ask them to come in because they really seem to need that personal contact. So you are at higher risk. I think if you have a pre-existing mental illness, that we're seeing some of our patients, really have a tough time. They have a re-exacerbation of their illness and that sort of thing, because it is very stressful for them. And so they really need to reach out. They just tell their doctor, hey, look, I want to come in, can you make it safe? Many places have safe practices that you can come in, for a visit and be relatively safe, seeing your therapist or your doctor. So I think that's important. But yeah, they're much more vulnerable if you have a pre-existing condition.
Agreed. I think with someone with bipolar disorder, I would certainly, those other recommendations, yes. But also you have to be especially careful about taking care of your sleep, making sure you have enough time to wind down. That's hard for us all to do, to get away from our devices, like everybody's right next to me.
Right.
How do we have enough time to take, to have distance, and really unplug so that we can have a break? That can be meditation. I think especially because people with bipolar disorder are very sensitive to changes in sleep, and into the, changes in daylight hours. And so having that part, and of course, like eating well and, eating regularly, making sure you're not hungry during the day, because during those meetings will be that much more exhausting. Having some time outside, right now our weather is amazing right now. Taking walks, just even that time can be good for your body. And if there is a lot of anxiety, which there can, we're talking about anxiety, having, aerobic exercise can really help. At least 30 minutes with your heart rate up, can actually help the anxiety. Meditation. So all these things that actually help your body anyway can certainly, that really ties into your mental health. So I would be, and sometimes that's kind of tedious. It's kind of boring. I've got to go to bed at 9:30. It's tiring sometimes to take care of your mental health. But I think it's worth it. So that the idea that maybe it'll just happen, it's kind of like with physical wellness. We do have to kind of plan to take care of ourselves. So
and I think that. Sorry, Dr. Ushroff. I think that
ahead.
Goes back to a lot of what we're saying about how we have to be very deliberate with what we're doing right now. And yes, it is extra work, but it's an investment in ourselves, in our loved ones, in our mental health. And let me, first of all, praise that person for knowing, what their symptoms are and what some of the triggers are. So I think just kind of taking stock personally and checking in, well, how am I really doing? And that's also a question to ask each other. Because we're used to getting the like, oh yeah, I'm good, I'm fine. Not just from our teenagers, but we also get it from our friends. And it's, no, how are you really? And letting people know, like, no, I actually really want to hear that as your friend. So I have friends, I take my psychologist coat and I'm just me, but I really want to know how they're doing, just because that's, you know, who I am as a person. But again, some of these things that we need to do, we may need to shift, even if we can get outside during the daylight for 10 minutes, because it does get so dark. This is something that happens every year, even without a pandemic. Doing things creatively, again, one of my best friends came over, and we had dinner in the driveway, and it was a way for us to be socially safe, you know, have that physical distance, but we got to see each other in person. And we both were kind of giddy at the idea of doing that. And so it was to share a meal. We did it in a way that we felt was safer for us. And so this is, again, why I'm saying, like, be creative, think outside the box, especially if you're single, especially if you're alone. I do know that we have, again, I work with a lot of medical populations. So this is also something that's going to be affecting a lot of our seniors who are alone. And I don't want to exclude them from this discussion. I have a lot of clients who are medically ill, who either live alone or they're medically vulnerable. And so it's just not particularly safe for them to go out. And this is where I want to encourage loved ones, check in, bug them a little bit, and see how they're doing. And if it is safe, just go outside for a little bit. Make sure that you're doing that, wearing a mask. These don't have to be big outings, but they actually make a difference in how we feel. And so encouraging each other to do these things, I think, is really important, not just as a mental health professional, but just for ourselves, checking in with ourselves, and then doing these things for our loved ones as well. You know, go outside, take a break at lunch.
Right.
And I just want to expound upon Dr. Taylor's comments. I think one of the things that help you sometimes when you're feeling badly is to reach out to someone else. So if you've got an elderly aunt or a grandparent or someone, reach out to them, check on them, call and see how they're doing. And sometimes just that very act can make you feel better and take focus away from your own problems, and you're doing something good for someone else. So I think that's really important. Keep in touch.
It's one of the things that I've heard is someone liked cooking. That was her hobby. So during this pandemic, she's stuck at home. She can't get out, and she's very sensitive to, you know, being exposed to the virus. So she's cooking at home and then giving it to the elderly.
Yes, absolutely.
And that's making her feel good in two ways, right?
Yes, right?
I have another young man who's actually walking other people's dogs. He feels safe with the dog. He doesn't feel safe with the people.
Mm-hmm.
So, right, it's time to think outside the box.
Is that what you would recommend for people? Like, one of my personal biggest aggravations right now is the people who are in nursing homes. And, you know, my family's coming to the realization that the holidays are going to go by and we're not going to have that person, you know, we're not even going to be able to make a visit to them. And I think a lot of people are struggling with that, knowing that a lot of nursing homes are still closed and not letting people in for visitors.
That's true.
So can you expand upon what you would recommend that we do for those loved ones who are going to be stuck in there for the holidays?
Well, I'm one that has loved ones in nursing homes. And I have to commend them because they're thinking outside of the box too. And I know there's been an increased number of drive-by opportunities. We get a chance to go and drive by in this parade type. We cannot touch or exchange any item. So if you bake cookies, you can't hand them out through the window or anything like that. But drive-bys, and then the other thing is more Skype visits and window visits and that sort of thing. And I know that's limiting, but it certainly makes the family feel good that we get to do something.
And I think even things like, again, purposefully, deliberately flooding them with cards. And it may be something like saying, you know, we're going to sit down and make 30 cards for Nana, one to reach each day during December. And so that they know, they know that they're loved. They could read this on this day or read this on this day. There's some really cute ideas on Pinterest. You can have kids make drawings of their hands and then almost make like an accordion thing, and you can mail a hug. So it's something that they can have and then put on their wall. So it's really helping to express love in different ways and make sure that they know that wow, if things were different, we so would love to be with you. And it, darn this pandemic for keeping us away. But boy, you are really in everything that we do. And you're so special that we're going to do these things. We're going to do these things for you.
Kris, can we address one of the questions that's in the chat
Please,
about domestic violence?
Absolutely.
So there is a question that's come up about someone dealing with and suffering underneath the threat of domestic violence. And we've heard the statistics here lately during the pandemic, those numbers are going up. People are stuck in their homes. They're dealing with personalities and situations they've not dealt with before. And then the financial stress and the illness. So there's a dynamic, and I'm not a professional, Serena. So I'm just, the question was, can NAMI help? Right. So as with any condition, whether it's a physical, emotional, or mental health condition, when that person is asking for help themselves, they say, okay, I've come to this place and now I want to do something different. Absolutely. NAMI is ready to partner, right? The complex issue around domestic violence and domestic abuse is you have the abuser and then you have the person who's choosing to stay for a lot of reasons, right? And until one or the other reaches out for help, there's really nothing NAMI can do. And I'm curious as to what other organizations can do, because, we've intervened in the past and we've partnered with the Houston Area Women's Center. And until that person is actually ready to partner for their own safety and security, then our hands are tied.
I'm going to put in the chat.
That's, we're seeing an increase in that. And that's a tough situation for anyone to be in. But again, you have to utilize your resources. These helplines, warm lines may have ways that you can call and talk about that. They may have referral centers. If you're in danger, you may need to call the police. I mean, you may need to do those sorts of things if you really are in danger. It's a very difficult concept, but there is people you can reach out to help you. Talk to your doctor, talk to family members, talk to your pastor about these sorts of issues, but don't keep yourself in a dangerous situation.
Yeah, and still reach out. We have the Houston Area Women's Center, the Fort Bend Area Women's Center, and so they're able to let you know what they have to offer. I know it's been a little more challenging with being able to actually shelter people, but I've heard that there may be other ways that they are able to help in some of the non-traditional ways. I think it also speaks, though, to being able to find ways for the whole family system to also deal with different stressors. And I will also just say, within teletherapy, some people are afraid to do it at home because they're in a situation with the person who is hurtful to them. I always give my clients an out. We have a safe topic that if they start talking about that topic, I know to change subjects. And so that is part of how we, even doing teletherapy, have changed things so that we try to create a safer environment when you're at home, because we certainly don't want to do anything that is going to aggravate the situation. But absolutely, if you are in an unsafe situation, reach out, see what the resources are available to you. Reach out for help.
I forgot one more. I used to be a social worker at an elementary school, and all of the districts have social workers, all of them. And if you reach out to the crisis team or anyone on a campus, any administrator, they have a full wraparound service to protect both the spouse who's reporting the abuse and the family members and the students. And I've watched them move mountains to keep everyone safe. So that is another resource, school districts.
I would still encourage it if you can work towards that person actually talking to someone, like Dr. Taylor said, like talking in therapy, maybe they could get to the point where they're able to make a decision or a change, right? Because it sounds like right now they may not. But if they don't feel, as a lot of times that people that are, involved in a domestic abuse situation feel so isolated. And there's very powerful things going on in that situation, which make it difficult to extricate oneself. And so having that other person, just another person that can hear that, hear and understand a little bit about what's going on, they may feel like they can be separate enough, like just their sense of self, and be able to be separate enough to make that move towards their own and their possibly their family safety. So it's a really delicate issue, but certainly there's lots of resources, and hopefully they can take like a tiny step in that direction.
Well, I would love to keep the conversation going. I mean, there's so many questions that were here when we started. There are new ones coming in. I do want to take a minute to point something out that someone commented that this particular viewer has been with Cannami since 2016, and it has, quote, changed their life. So I want to put that out there, that's just one resource that's available. Angelina, I know that's music to your ears. I also want to make sure, yeah, amen. And I also want to make sure that that there's a national suicide prevention hotline. That number is 800-273-TALK. And there's also, this came in as a comment too, the Harris Center has a crisis line. That number is 866-970-4770. Also behind the scenes, Haley and I know that we have a producer. His name is Carlos. When our conversation is over, he will put together an article for our website, and you'll find those numbers. If you're listening and you still need help, you'll find those numbers online on this website, our website, and the article. And you'll also have more information about the warm lines, for example, that we've been talking about and discussing. I think, Haley, if it's okay with you, as we kind of wrap up, I'd like to give each of our panelists just one more opportunity to kind of share kind of maybe some good advice as we, again, kind of entering the holidays. We're still in the midst of this pandemic and so much going on in our lives. If you kind of leave us all with just some wisdom that we could all use, maybe that will help us calm down and understand that there's light at the end of the tunnel.
Well, I have a thought, Kris.
Sure.
Just when as we're all facing stress, and all of us are going through this. I think one of the comments mentioned that mental health providers, clearly we're all in this together. As we face each stress, we kind of will manage it or use a kind of skill or adapt in a certain way. And so we hope to look for things that are adaptive, that, like we've been talking about today, using humor, reaching out, trying new things. Also being very careful about what we're choosing to do in each day, prioritizing versus things that may be more maladaptive, such as just shutting down, isolating, staying away, or substance use. If you notice yourself using more substances to try and make it through, that could actually worsen your mood as you move along through this. So or even denying that anything's wrong, right? We talked about denial as a problem, denying there's a pandemic or denying that you're upset about it, that those things can actually make you feel worse. So just looking at, we all have defense mechanisms, right? And so trying to really push, and it does take some effort, but hopefully as we do it together, we can get that help to find some new experiences that are enjoyable.
And I was going to say, realize that help is available. Reach out. As the holidays come up, lower your expectations. These are going to be different holidays. And so we need to lower our expectations about what's happened before and deal with and use your creative minds to sort of think of ways that you can reach out and make the best of it. We will get through this. Stay hopeful. We'll get through it.
Don't go alone. Don't try to do this on your own. If you're stuck in a rut, if you're unproductive and you can't figure out why, reach out, like Dr. Knox said, to any one of us. Let's put our heads together. There's a path for you. And so I think that a good friend once told me, you're just trying to do everything by yourself. And oftentimes we can't make it alone.
And Kris, let me also just add, so you mentioned the National Suicide Prevention Lifeline. Within that, there is a line for military. There's a way if you're hearing impaired, there is a line within that too. I often encourage people to literally program that number in their phones. Although if you Google suicide prevention, it's the first thing that comes up. There's also a text line, and the number for the text line, if you text home to 741 741. That's another resource. So I just wanted to add those. But I would say in terms of the holiday season and mental health, again, as others have said, lower your expectations. That doesn't mean don't have any, but right. Just, again, it's adjusting. It's adjusting and really thinking about what's important. It is choosing what you want to focus on. Are we choosing to focus on what we can't do this year? Are we choosing to focus on what we can't have this year? Or are we choosing to focus on the things that we do have? My son last night, I was saying, I'm a little sad because we're not going to be able to see Nana and Papa this year. My parents who are older and have health issues and live in Florida. And he said, and I said, well, so what should I do? And he said, well, Mommy, you feel good when you take care of other people. And by not going to see them, you're taking care of their health. So you should think about that. And so, yeah, wisdom from 11-year-old. Doesn't happen all the time, but I have to give him props for that. But again, choosing what we want to focus on, and again, being deliberate with that. It doesn't mean that we ignore how we feel. I'm very much about acknowledging, I'm sad that things are how they are. And at the same time, I'm really glad that I could have dinner in the driveway with my friend. Or I'm glad that through Zoom, I've met somebody new, and maybe that's something that we can foster. So that would be my last bit. And definitely don't go it alone.
Well, I want to thank everybody for participating. And I feel so honored that so many of our viewers trusted us with very personal questions. And I feel honored that you guys, being the experts in your field, chose to take time out of your day to help us out with this subject. You were crucial in getting very good information out to them, and you've provided a lot of resources that we didn't know about before. So we are going to put that information with all of the resources that you mentioned in the same article that people use to register for tonight's event. So go back to that article if you need any of the resources that were mentioned tonight. Kris, I'm also pretty upset that we didn't get to a lot of the questions. People had submitted quite a few, and we weren't able to get to them all, but we appreciate it.
And there are going to be some questions that weren't answered. And through this conversations, I think some people will have more questions. If you have more, please feel free to submit those to our website, click2houston.com. It's an easy way to submit those, and hopefully one of these experts will see that and perhaps can reach out or point in the right direction. Also in the article, again, there will be numbers that you can use for resources that are available here in the Houston area or wherever you may be.